Mad honey, known as deli ball in Turkey or mochi in Nepal, is often shrouded in mystery, framed by tales of ancient warriors defeated by its hallucinogenic properties or modern thrill seekers chasing a natural high. However, as medical professionals, we must look past the folklore and examine the molecular reality of this substance. Mad honey is not a product of typical foraging. It is a specialized honey produced when honeybees collect nectar from specific species of the rhododendron genus, particularly Rhododendron ponticum and Rhododendron luteum. These plants contain potent diterpenes known as grayanotoxins. While the word toxin often carries a negative connotation, in modern pharmacology, it represents a bioactive compound with the potential for both therapeutic benefit and physiological disruption when studied under controlled conditions. To understand how doctors interpret mad honey, we must first look at its action on the cellular level. Grayanotoxins are unique because of their affinity for voltage-gated sodium channels, the specialized gates in our cell membranes that allow electrical signals to travel through nerves and muscles. In a healthy state, these channels open to allow sodium ions into the cell and then quickly close to reset. Grayanotoxins disrupt this cycle by binding to the channels in their open state and preventing them from closing. This keeps the cell in a prolonged state of depolarization. For the cardiovascular system, this results in a potent cholinergic effect, stimulating the vagus nerve, which in turn slows the heart rate and lowers blood pressure. While an overdose can lead to medical emergencies, these specific mechanisms have piqued the interest of researchers looking into natural ways to manage chronic conditions like hypertension. Modern science is currently investigating several traditional claims regarding mad honey with promising, albeit early, results. One of the most common traditional uses for mad honey is the treatment of hypertension. Recent studies investigating the antihypertensive effects of grayanotoxin 3 in models have demonstrated that controlled doses could significantly reduce blood pressure, behaving similarly to certain pharmaceutical ACE inhibitors by helping to relax cardiovascular strain. Beyond the heart, clinical observations in regions like the Black Sea suggest that mad honey is frequently used to treat gastrointestinal issues such as peptic ulcers and gastritis. Modern analysis suggests its high antioxidant profile and antimicrobial properties help reduce inflammation in the gastric lining and inhibit the growth of harmful bacteria. Furthermore, some experimental studies have even suggested that these unique bioactive compounds might accelerate bone fracture healing by stimulating cellular pathways responsible for tissue regeneration. As a medical professional, I must emphasize that natural does not inherently mean safe. And the primary risk with mad honey is its unpredictability. The concentration of grayanotoxins varies wildly based on the season, the altitude, and the specific floral source. To ensure safe usage, there are several standard medical recommendations to follow. Clinical data suggests that symptoms of intoxication can begin with as little as 15 to 30 grams. So, for therapeutic purposes, it is generally recommended to start with no more than half a teaspoon to gauge individual sensitivity. It is also vital to know the source. Authentic mad honey typically has a distinct reddish tint and a sharp bitter aftertaste that causes a slight burning sensation in the throat. Additionally, because grayanotoxins are sensitive to temperature, using mad honey in boiling liquids can degrade the bioactive compounds, rendering the medicinal benefits void. Most importantly, there are high-risk groups who should avoid this substance entirely. Mad honey should never be consumed by children, pregnant women, or individuals with pre-existing heart conditions. It is particularly dangerous for those already taking blood pressure medications, as the honey can dangerously amplify the effects of those drugs. Mad honey is a remarkable example of how ancient traditional knowledge and modern toxicology intersect. While it offers intriguing potential, it must be approached with the same respect and caution one would accord any pharmaceutical agent. Science is slowly moving this bitter honey from the realm of myth into the light of clinical potential. If you found this medical breakdown helpful and want to learn more about the intersection of traditional medicine and modern research, please subscribe for more science-based insights.